Hello, this is Dr. David Bilstrom from the Autoimmune Lifestyle and the International Autoimmune Institute, and this is Did You Know? And we're coming to you today from Lower Palisades Lake in Idaho, just a little east of Swan Valley, about a 2-hour hike up here. There's another lake that's the Upper Palisades Lake, and we're not going there today. We've done that and we're like, yeah, not today. But what I'd like to talk to you today, did you know that infections are such huge drivers of autoimmune disease? And you can basically guess what body part has an infection and what infection is involved by what kind of autoimmune disease people have. Now, in the new book coming out, A Nurse Practitioner's Guide to Autoimmune Medicine, Reversing and Preventing All Autoimmunity, we'll talk specifically about which infections to test for, exactly how to do it. And you can run this in any lab, any hospital, any lab company can run these labs. Look in the blood for the systemic stuff, and then you'll also be doing like digestive stool analyses and GI panels to look for other infections, and you'll be amazed at what kind of infections you get. So if you get the people with ulcerative colitis and Crohn's and celiac disease, you can almost bet your bottom dollar that they have a GI infection that nobody's even thought to check for, but that made their gut the weak spot. And when the immune system gets confused, it's going to attack a certain body part. Why would it attack the gut? There's probably a bad infection there. Some of them are infections you're familiar with, such as salmonella, and you're going to find these bugs. Some bugs can kill people quick, like salmonella poisoning, and kill you really quick, or it can kill you slow and steady over years and decades, and you'll find salmonella. But you find so much mold, so much candida, so much bacteria. You'll find H. pylori, you'll find C. diff, and you're like, holy cow, how can nobody have ever thought to check this person with all these gut symptoms in the first place, let alone once they get bad enough, get ulcerative colitis, Crohn's, and celiac disease. You're also going to find a lot of mycoplasma in your rheumatoid arthritis and lupus patients. If a patient turns ANA positive, no other antibodies attacking the DNA other than a positive ANA, which is Bilstrom's nuclearitis, you pretty much know mycoplasma is involved. You got a lot of brainy stuff, including when you don't even have autoimmune disease, but you have like kids with developmental delays, autism spectrum disorder, ADD, ADHD, anxiety, panic attacks, insomnia. You're going to find things like herpes virus 6, Coxsackie virus. You're going to find activated Epstein-Barr virus. You're probably going to find a lot of strep. Mycoplasma is a big one because it gives you a lot of pain, gives you a lot of brain stuff, and it's usually involved, or a lot of times involved, in Hashimoto's or Graves' disease because it loves to go after the thyroid as well. So you get your patients in with the autoimmune disease, and you kind of know what infections, you're going to know what infections to test for. You're going to know what you're kind of going to find. You're going to know how to get rid of it. Now, in the advanced course, the autoimmune paradigm, the experts course, we're going to go into much more detail about these infections and how you can get rid of them. And some are awful stubborn to get rid of, especially if by the time people that get to you, they're on medicines that suppress the immune system. That can make it super challenging to get rid of these infections to ultimately reverse the autoimmune disease. You can do it, but we're going to talk more about that. And I look forward to seeing you in the experts course. Just want to let you know that for the certification part, you got to be a practitioner. But even non-practitioners, you find yourself someplace in the country or the world where there's nobody that knows how to do this. You don't have a nurse practitioner who's the expert in the neighborhood yet. You have an autoimmune disease, a loved one has an autoimmune disease. It's going to teach you a lot about why this happens, what tests need to be run, and then how to get rid of all these kind of things. And you won't get certified. You don't have to do the assignments though either for each module, but it'll help a lot of folks really understand this and why we're going to change the world. And like the book says, and like the song says, got a revolution, got to revolution. Thank you.